So I think we will get our session 3 Partners in Pain Yorkton area community event underway. Thanks everyone for joining us on this Wednesday. I think it's sunny where I live, but I'm not sure. Hopefully it's sunny in Yorkton too. So today's session, we're talking about some tools and actually programs and self-referral and management options for folks living with pain. I'm really excited about this session because it's going to give you folks some information about where you can access care, which I know is sometimes really tricky in our healthcare system. Before we get started, I'm going to start off with our land acknowledgement again. So as we gather today, it's important to acknowledge that we are on treaty land. I'm coming to you from Treaty 6, which is the traditional territory of the Cree, Saulteaux, Stoney, Nakoda, and Dakota. Many of you are joining from Treaty 4 territory of the Nihawa Cree, Saulteaux, Dakota, Lakota, Nakota, and formerly Blackfoot. We acknowledge the traditional homeland of the Métis and honor their contributions. Once again, this land commitment for me is about reaffirming my commitment to reconciliation and to these relationships. And it's a reminder to be kind. And I'm going to put a link actually, because every time I do these acknowledgements, I think it's important to share why we're doing them. So I thought I'd share that with you folks today. I know a theme of our sessions is education. So I popped a link into the chat for more information about land acknowledgements and why we include them in our events. Also wanted to talk a little bit about how this great event came to be. So this workshop series grew out of the Improving Pain in Saskatchewan Collaborative Research Project, which once again aims to give pain a voice by bringing people together to share information and to plan some action with how we can improve how pain is managed in our province. So I've said this before, but the project started with interviewing folks in Yorkton and Saskatoon and Regina. And that's part of how this project came to be, was feedback from some of the folks in Yorkton suggested that this would be a great initiative. So today is our final session for this particular project, but I know Susan is doing some great work to hopefully continue this work. And I'm hoping that we can continue these sessions. I'm not sure what your experience has been, but I thought that this has been a great opportunity to share our voices, hear your stories, hear our voices, and it's been an excellent initiative. So with that, we're going to get started with our first presentation of the day. So we're going to start with our healthcare providers, and Tracy Fichtner is going to be our first speaker. So Tracy has lived most of her life in the Yorkton area. She's a registered nurse in her 30th year of work in Yorkton, which seems impossible because I thought she's only in her 20s. Tracy worked for 26 years in the Yorkton Hospital, 24 of those years in ICU. As an RN, Tracy thought she knew quite a lot about how to treat pain, but found she was sadly mistaken. After 3 work-related back and shoulder injuries, Tracy was able to continue working in acute care and now works in primary health care. She has tried many different treatments and still applies multiple approaches to manage her daily chronic pain. She lives in a rural area with a very busy household. Her husband runs a self-employed contracting business. Her son works with his dad to save money to finish his degree, and her daughter is taking her first year university online at home. I've had the pleasure of working with Tracy and planning some of these sessions, and I have to say she's such a gem and an awesome resource for the Yorkton area. Her perspective as a healthcare provider and a person living with pain is really significant. So with that, here's Tracy.
Thank you, Kelly. I'm just going to share my screen here so that we can get underway here. So I'm going to just do the slideshow. Hopefully you are seeing the slideshow now, and I'm just going to get my presenter view up here. So this pain cycle has, as Kelly had mentioned, I live with chronic pain daily, and I use a multidisciplinary approach for pain management on a daily basis. And the key for me was learning about this pain cycle and how to break it. I felt like a hamster going round and round on these problems, and hopefully today's session will offer you more options to break this cycle. I found in my life and work that chronic pain management can be especially challenging if we do not have a physician or we have long wait times to receive care. During this time, people make decisions about how they will manage their pain, whether they realize it or not. Some people will actively seek out methods to manage their pain, and they're referred to as active self-managers, and others will sit quietly, not doing anything that might provoke their pain, and they're referred to as passive self-managers. We all make decisions that affect what we're going to do and when we're going to do them, and this is called self-management. But self-referrals are extremely beneficial for our chronic pain self-management. So if we don't have a family physician or nurse practitioner, then we must seek care elsewhere. Other options in our area are the Healthy Living Program at Primary Healthcare based out of Yorkton, the use of walk-in clinics by calling Healthline 811. And by the way, this is not a COVID hotline, as many people have heard. Initially, you'll speak with an RN who assesses your symptoms and then guides your care to attend a walk-in clinic, to see your doctor, or to access emergency services if necessary. 811 is also staffed with registered psychiatric nurses, social workers, and physicians. You can also contact Lumica. It's essentially an on-call physician service. A care coordinator reviews your symptoms and then directs your care to a physician who may diagnose, treat, prescribe, refer, or advise other forms of treatment. Or you might access a private care clinic. In Yorkton, we now have a nurse practitioner operating a private clinic. And you may contact your pharmacist. As we heard from Hillary in session 2, pharmacists have a plethora of knowledge and healthcare equipment options in addition to being able to prescribe some medications. The Healthy Living Program from the primary health care offers education and care in these areas, as many of these chronic conditions also have an element of chronic pain associated with them. This is a multidisciplinary team of registered nurses, registered dietitians, exercise therapists, and a social worker who may collaborate if necessary to optimize your care. Although the pandemic has stopped the group programs, it has not stopped appointments by phone, virtual care, or if required, in office. The Refresh program is presented via WebEx. Participants learn about stress management, positive coping skills and self-care, assertiveness, communication, mindfulness training, and more. The Live Well with Chronic Conditions and Live Well with Chronic Pain programs are in the process of changing from in-person workshops to telephone and virtual programs. Watch for more to come in this area of self-management. Next, we're going to look at allied healthcare self-referrals. Many extended healthcare plans now cover these medical expenses without a referral from a physician or nurse practitioner. Physiotherapists are the best providers who have the time to physically and comprehensively assess you. In Yorkton, we have Prairie View Physiotherapy and Functional Rehabilitation. Of note, Cornerstone Therapies does require a physician or nurse practitioner referral. Chiropractors can be vital in assessing the alignment of the body. Some chiropractors also perform active release technique, a manual therapy technique that works to correct soft tissue and restrictions that may cause pain and mobility issues. In Yorkton alone, there are 5 chiropractors listed, and this slide is just to name a few. Massage therapy can also be beneficial, but it is important to know their training and the treatments that they provide. Many extended healthcare plans only cover registered massage therapy expenses. Your healthcare plan usually has a list of accepted providers for your reference. This slide explains an explanation for your future reference to be able to choose the best provider for your needs. Regardless of which massage treatment you choose, please do not underestimate the restorative feelings of human touch. However, for pain management or ongoing treatment plans to mitigate health conditions, choose a registered massage therapist. In Yorkton alone, there are 17 massage therapists listed. There are a few that I was able to contact to confirm that they are accepting new patients, but there may be more. Alternative healthcare provider is the term that registered acupuncturists prefer to use. There are 3 different levels of certification in Canada. As Samita said in session 2, dry needling and acupuncture are different techniques. The slide above lists the only provider that I could contact that is registered and is accepting new patients. However, there may be more. Yoga can play a key role in our mind-body connection. In Yorkton, there are 12 contacts listed, and this slide just names a few. Other types of self-management may include other services to soothe your mind and body. Some of these services are closed because of the pandemic, but keep them in mind when meeting your personal needs. Researching specific pain conditions and management may require more than the self-referral services. Finding what you need may be as simple as using the phone book and making a few calls, or it may take some searching. Libraries, books, and magazines may be a great resource if the information is credible and current. The internet is the fastest growing source of information. However, there may be incorrect or dangerous information. Never assume it is automatically trustworthy. Check the credibility in the URL or the address on the internet for clues such as .edu, referencing an educational site, or .ca, .gov, or .org. Be cautious with .com. They're commercial organizational sites, as they're also selling products, but they still might be a good resource. Online therapy user involves reviewing educational material online with the support of a therapist or guide. These courses help with our thoughts, behaviors, and physical symptoms. Along with chronic pain, we often experience anxiety and depression. The Chronic Health Conditions course, including chronic pain, is the course which helps us address and manage our pain and mood. Audiobooks, such as Living a Healthy Life with Chronic Pain, which is used in Live Well, is an all-encompassing self-management resource and is available as a free PDF. Podcasts such as Put It Together with Daniel Garza are conversations with guests from all walks of life to discover their journeys and struggles and how they ultimately put it all together. Support groups can be pivotal in helping us feel validated and not alone. Sask Pain is one such example. Nonprofit agencies are also great sources of information and support. TV channels such as AMI's program, #IGotThis, allows you to meet people who have discovered ways to cope with physical disabilities or mental health challenges and move forward with their lives. I have to admit, I was reluctant or perhaps more afraid to try new therapies thinking my pain would flare. This self-care cycle helps keep us on the right path to being a good self-manager. So in summary, when considering a self-referral, it is important to do some research into who you are choosing to seek care from and what treatment they are providing. Seeking out support, feeling validated, and trying new techniques was the best thing that I ever did. There is no easy button or one treatment that cures chronic pain. It requires daily work. I think I've watched the YouTube video listed here a dozen times as a reminder of the holistic ways to manage my pain. I continue to work with and research more therapies, and that's why I choose to stay connected with people who are treating and living with chronic pain. And I hope you will too. Thank you for taking the time to join me today.
Thank you, Tracy. That was excellent information. I really appreciate, as you were going through it, the variety of resources. You know, it wasn't just like, I know you brought up the slide with art therapy and just really different ways of managing pain. So thank you very much for that information. Like I said, Tracy's slides will be provided with folks, so links to all of those options that she mentioned. With that, we're going to ask Taylor Raiche to join us now to speak on some additional resources to help folks with managing chronic pain. So Taylor Raiche is a clinical pharmacist at the Medication Assessment Center. She very much enjoys working with individuals who use medications to educate and empower so that their medication regimen is as effective, safe, and convenient as possible. Taylor enjoys taking on projects around the house and yard and has been honing her cooking skills over the past year. I also have the pleasure of working with Taylor at the Mac IOPS, and I have to say that any person that gets an experience to or an opportunity to work with Taylor is certainly in very good hands. So with that, I'd like to invite Taylor to join our group.
Well, hello, everyone. Good afternoon. As Kelly said, it's a beautiful sunny day here in Saskatoon. I can see the sun shining through my basement windows here, so I'm hoping that it's nice and sunny in Yorkton too. So I've got my screen up. Can you see my screen, Kelly? You want to confirm that for me? Excellent. Okay, well, with that, let's get rolling. So I'm here on behalf of the University of Saskatchewan to talk about some of the clinical services. So the university as an institution certainly offers a lot to the province. And what you might not know is that as a person living with chronic pain, there's some direct services that you might be able to access free of charge just for living in the province of Saskatchewan that may help you along this journey of managing your pain. So as Kelly said, my name is Taylor, and thanks so much for that wonderful introduction. I've been all over the province, but I've never been to Yorkton. I feel like I'm in there, there in spirit today. So this is an exciting opportunity for me. So as Kelly mentioned, I do work at the University of Saskatchewan. I've got a nice, beautiful office, one of these windows up here that I was at for a total of 8 days when I started this position in March of 2020. And this is me over the past year, working from home, sitting in this chair over the past 365 days, providing virtual care has been such a pleasure. It's really been a facilitator of helping people who live with pain, but in many ways, I feel like this monkey sometimes when we have the technological issues we're all familiar with. So as I mentioned, today I'm going to talk to you about some of the clinical services at the university. So specifically, these are clinical services that are facilitated through the College of Pharmacy and Nutrition, which is one of the health professional faculties at the university. I'm going to talk about 3 specific services today, and we'll get into them in more detail here in just a moment. So I'm popping up on my screen some logos. There's the Medication Assessment Center on the left, and then you see on the right MAC IOPS, which is an acronym that I'm so thankful for because it stands for Medication Assessment Center Interprofessional Opioid Pain Service, which really is a mouthful. So when I refer to MAC IOPS, I'm referring to this service, which is essentially just a branch of the Medication Assessment Center. And I'll tell you a little bit more about what both of these programs may offer. So if you're interested in knowing more detail than what I certainly can get into the allotted time today, you can visit usask.ca/pharmacist and learn all about what the Medication Assessment Center is. So at the MAC, we offer 3 kind of broad categories of services. The first being general medication assessments. So these are offered to anyone in the province of Saskatchewan who takes medications, whether it's 2 medications or 22 medications. Myself and my colleagues are more than happy to meet with individuals one-on-one to really walk through what that medication taking experience looks like for the individual and try as best as possible to reconcile and educate and simplify and condense to make sure that, as Kelly mentioned, we have you on the most effective, safe, and convenient regimen that you can be on. So we work along with primary care providers, including family physicians and nurse practitioners and other community supports as we navigate through some of those decisions. Secondly, we have our MAC IOPS program. So that's our Chronic Pain and Opioid Management Division, which is probably most relevant to the group here today. So I'm so excited. This is a new service that's been around for the past 1.5 years or so. So it's a pharmacist-led clinic. So very much the service that you would receive in a general medication assessment with one of our pharmacists. But very recently, we expanded our team and now have a physical therapist and a few social workers on board with us as well. And we do have a consulting chronic pain physician who works remotely and does consult on the cases that we end up discussing together as a team. So as best as possible, those of us who are providing care to the individual who's living with chronic pain are really coming to it with that big picture perspective, having a nice, well-rounded assessment of what we can try to do to help you manage from a medication perspective, a movement perspective, and a mind perspective as we think about those 3 M's and how they can contribute to your overall holistic management as somebody who might live with chronic pain. And then thirdly, a service that myself and my colleague Eric provide is called Cognitive Behavioral Therapy for Insomnia, or CBTI for short. We love acronyms at the MAC. So this is for individuals who might struggle with sleep or chronic insomnia on a longer term basis. Interestingly enough, as a pharmacist, it's a little bit counterintuitive in that this is a non-medication strategy to help individuals with sleep. So oftentimes what we're doing is working with individuals to really start to peel back the layers of what has caused this insomnia over time, and can we make behavioral adjustments? And also, can we maybe investigate a little bit the way that we think about our sleep to press that reset button on the natural hardware we're all born with, so that eventually maybe we can scale back on some medications and trust our own natural body clock a little bit more. So that's what we offer at the Medication Assessment Center. So here's just another visual for you of what the MAC IOPS program looks like. So you as an individual with lived experience having chronic pain are that bright spot in the middle of this circle that's surrounding you and really at the center of it. So of course you have your primary care provider, if you have a family doctor or nurse practitioner, specialists who might be involved, community supports like home care or physical therapists or massage or art therapists, all of those people that we just heard about, a mental health team, your community pharmacy team, which is integral in getting your medications to you safely. And then we can offer to come along as the MAC IOPS team, which is a little hub kind of within a bigger hub. So as I mentioned, we've got our pharmacists, including myself, our physical therapists, our social workers, and our consulting physician who can help round out that assessment and work amongst your existing team in the community to help you achieve as best kind of a rounded plan as we can for pain management. We also offer a few other services, and you don't need to be a client of our service to access these. They're freely available on our website, so usask.ca/pharmacist. So we've got a chronic pain toolkit on our website. We've got a digital toolkit. I know it's probably very small on your screen, but if you visit our website, you can click on each of those headers and find all sorts of recommended mobile apps and YouTube videos and books to look into and websites to explore at your own pace if you're interested. And if you'd prefer to actually print that off, we do have a print ready version for you as well on our website. So we do offer self-referrals, and we accept self-referrals all the time to both the General Medication Assessment Center for either a medication assessment or CBTI, as well as for the MAC IOPS program. So on our website, you'll find a tab where you can click into self-refer, and then I'll actually orient you to a page where you can fill out that information securely online, or you can actually download our referral form and take it to your primary care provider to fill out and to connect with us via that means. Oftentimes, we do recommend that if you're wanting to come to the MAC for the MAC IOPS service, it's a really great idea to have that discussion with your family physician or nurse practitioner to make sure that we're all coming to this from a team perspective. So if you wanted to talk with them and provide this information, we would be more than happy to connect with them individually as well to get the ball rolling on connecting for your care. So here's our contact information. I won't go into it in detail because you will receive these slides. So now we have MedSask. MedSask is another clinical service at the University of Saskatchewan under the umbrella of the College of Pharmacy and Nutrition Clinical Services. So this is Kelly's other job. So Kelly certainly is our resident expert on all things MedSask. And what MedSask is a drug information service for the people of Saskatchewan, whether they are people taking medications and consumers of medical care, or they're actually providers on the front lines who are providing medications and medical related services. So it's a telephone line that you can call in throughout the week. They're open every day, and you can ask questions about, I think I might be having a side effect. Can you tell me a little bit more about this? Or, is this a drug interaction that I should be concerned about? Or I was thinking about taking this over the counter medication, but I'm wondering if it's safe in the context of my other medications. So certainly your community pharmacy team can answer many of those questions, but if you're pressed and it's 11 o'clock at night, you don't know what else to do, you can call MedSask and they can help you navigate those situations. So you can contact MedSask at those hours there on the phone lines. They also have an email for general inquiries, and then you can find more information on their website as well. And lastly, we've got a nutrition service offered through the University of Saskatchewan. So because we're the College of Pharmacy and Nutrition, we have dietetics colleagues who are very well respected in the field of providing information around nutrition and food choices. So we have a dietitian call center called Eat Well Saskatchewan. So anyone living within the province can call this hotline and speak with a registered dietitian, and that can be really anything from, I've got a food allergy and I'm wondering if you could tell me a little bit more about what I can and what I can't consume in terms of prepackaged foods, or wanting more information on finding more effective resources or cost-effective resources for finding, balance in your diet. So that dietitian can help you navigate those situations, or even connect you with a local dietitian to actually work with you on a more one-on-one basis. And that's their contact information there. So those are three of the services that we have offered through the College of Pharmacy and Nutrition at the University of Saskatchewan. I'm more than happy to answer some questions if you have more. A lot of this information, though, can be found on each respective website for the service. So hopefully you're able to connect with some of those services if they're of interest to you.
Thank you, Taylor. That was excellent and a great overview of the services that we offer at the university. Probably what I'm most proud of is the accessibility. They're all a phone call away. And Taylor's got that information on the slides, which we will be sharing. So you will have access to those phone numbers. So thank you so much, Taylor. See, she's great. We do have an opportunity for some questions and answers for Tracy and Taylor. So if anyone has questions, you can raise your hands. You can pop them into the chat. You can private message me or Celine if you feel more comfortable doing that. And just to kind of get the ball rolling, I'm wondering if Tracy and Taylor, if you guys can comment on the impact of COVID-19 and if most of these services that you've kind of linked with are still available. You know, Tracy, I know with some of the Live Well programs, if you can kind of talk about the impact and what folks can still access considering some of the restrictions that we have. Taylor, I see you nodding. I'm going to go to you first and then maybe Tracy, if you can answer that second. Okay, perfect. Taylor, it's yours.
I think that's perfect, Kelly, because it's a quick answer. Yes, all of the services at the University of Saskatchewan that I just described are in full force, available to you virtually. So the Medication Assessment Center, we offer telephone visits with clients. We offer video visits, which would look something very similar to this. All of those means we do our very best and have tried to do our due diligence to make sure that they are protected under health legislation, to make sure that your information remains confidential. We also are starting to offer in-person visits again, kind of working our way back into that. So a number of those different approaches might be applicable to you. MedSask and Eat Well Saskatchewan are always virtual services. They are call services, call-in centers, so you can access them by phone anytime. That's not changing.
Great, thanks, Taylor. Tracy?
Well, for our area in primary healthcare, it's changed completely because we were in-person or program orientated. So we would take the cardiac and pulmonary roadshow and we would go to the Gallagher Center, or we would go to the Horizon Center in Melville, and we would be on the walking tracks with people, fresh post heart bypass or those kind of things. So this is very different. And so talking on the phone with someone for an hour to an hour and a half, trying to get them to calm down, learn how to take their nitro and manage their chest pain and those kind of things. A whole new ball game, and but we're doing our best through phone to be able to do that. Exercise therapy is using more virtual care because it's very hard to describe a movement or motion without actually demonstrating it. So the exercise therapists are doing more virtual care. Diabetes has spiked. We have so many new referrals, new diagnoses. And likely due to stress and those kinds of things. So a lot of those are in-office appointments with the registered nurse and the registered dietitian together, where they're teaching insulin titration, insulin administration, those kind of things. But definitely, we're always kind of on pins and needles because being nurses, you never know if the pandemic is going to have you be redeployed somewhere else. So we have had to scramble a few days to reschedule appointments, but we've tried to keep some consistency where at least we have one nurse in the clinic all the time, and maybe appointments get bumped from one nurse to another, and we cover for each other to some degree because there's some specialties like with diabetes that you've built a relationship, and it's just better for the patient if we do continuous care with the same provider. So where it's ultimately patient-centered, and through a pandemic, we're trying to keep the patient at the top, and we're really advocating that patient services not be completely dropped off to manage the pandemic. So we're trying to balance the teeter-totter, so to speak.
Mm-hmm. Thank you for your advocacy. Taylor, really quick question. Then I have one more for Tracy from the chat, for Tracy from the chat. Taylor, can you speak to costs? Is there a cost for accessing these services at the university?
These costs are entirely free. They just require that you live in the province of Saskatchewan. So if you or a loved one, friend, family member, a neighbor, someone you meet at the grocery store in passing, if they live within the province, they can give us a phone call and we can connect with them.
Okay, I know that is always really important for folks, right? Is the cost, because some of these treatments come with significant price tags. A question for Tracy: any physiotherapy services covered by Saskatchewan Health Authority in the Yorkton area? Speaking of cost, a relevant question. So any physiotherapy services covered by SHA in the Yorkton area, for example, pre or post surgery?
Yeah, so that would be done through Cornerstone Therapies, and that is a physician or nurse practitioner referral. The Prairie View Physiotherapy and Functional Rehab, those are fee for services. So the only free physio would be through Cornerstone Therapies. They were actually relocated to our primary health care center for a while. So that was kind of fun, seeing all these post-op knee replacements coming in and doing their physio up and down the hallway. That was kind of fun, being that I'm an acute care history. It was nice to see those people making fast progress. But that is the only place in Yorkton that you can get free physiotherapy.
Okay, thanks for that, Tracy. Susan, I've got your question. In the interest of time, I'm going to keep things moving to move to our person with lived experience. But I know Tracy and Taylor will be with us through the session. And so hopefully we can circle back around to some more of these Q&As once we get through our formal program today. So next, we're going to hear from our person with lived experience. So I'd like to invite Wanda to join us here. So Wanda Poirier is 55 years old and has been living with chronic pain for many years. She says she's happy to be here today to share her pain story. Now, I didn't get a lot of information from Wanda before. So Wanda, I'm just wondering if you could, even before we start talking about your pain journey, if you can tell us a little bit more about yourself. It sounds like you're in the Yorkton area. Anything else about yourself that you'd like to share today?
Yeah, I work for an organization who supports adults with intellectual disabilities, and I've been in that career for 30 years now, and just moved into a new position as a program coordinator. So I'm pretty excited about that. And I live on acreage with my husband, and I love to garden and love to stay active. And my family says I'm a workaholic and need to slow down.
I always appreciate you folks living on acreages. I can barely take care of my city lot, never mind acres of land.
Yeah.
So, yeah, Wanda, I'm wondering if you could first tell us a little bit about your pain journey and your experiences living with chronic pain.
So my pain story? Okay. In 2012, I was diagnosed with degenerative disc disease and spinal stenosis, which caused intense pain that limits me to even walking short distance when I'm in a bad flare-up. After being diagnosed, I told myself that I needed to focus on getting myself better, just take a few pain meds, and thinking I'm going to cure myself and I'll soon be living a pain-free life. Boy, was I wrong. I grew up on my family farm, owning and operating my great-grandfather's homestead near Simpson, Saskatchewan. Me and my older sister and I helped my father run the farm, working long days of physical labor. I picked stones by hand, stooped and hauled bales, and ran combines as we did custom work. And all the unsaid duties that I probably could go on and on talking and working long hours, even bent over in my garden. So I think it would be fair to say that I have been physically active most of my life. And I was also active in school and played many sports throughout my high school years and curled for many years as well. At this time, my mental health was pretty good because I felt that I had got this pain issue under control, and I knew what I needed to do moving forward, and it must not be that bad. I told myself that I'm getting older and I just need to slow down and stop working so hard. As time went on, my pain increased. My mental health became an issue. I was dealing with many emotions. I became depressed, scared, angry, and so disappointed that the pain did not go away as I was telling myself in hopes that it would. Everything that I was doing right my pain got worse. And unfortunately, the over-the-counter medications weren't giving me the relief I needed. Sometimes I ended up in the hospital for pain injections. And that wasn't an option until that wasn't an option anymore. One time I was in the hospital, and a nurse actually that I went to high school with said that she heard about a chiropractor from Manitoba that treated his patients with an electric device. She said that her mother was there and had good relief. Right away, I asked her for the contact information and committed to driving to Manitoba once a week for the next 6 weeks, in which, in the end, I had no relief. And again, I felt sad and depressed once again. I still wasn't giving up on myself. I was determined that I was going to find someone that was going to make me better, still naive about my condition. One day, a co-worker of mine mentioned about a chiropractor that she had found, and that was good for her. This time, I committed myself to driving an hour away once a week for 7 weeks. Not to mention physio, massage, acupuncture appointments, spine pathways, going for second opinions to hear that my back is a wreck and it's not going to get better, and I need to go home and make the best of it. Talk to my family doctor about pain management, lose some weight, stay active, and change your lifestyle. One of the specialists that I went to showed me an X-ray of what my spine looked like and said that he had one thing that he could do for me, and that was fusing my spine from the neck down. But it would leave me completely disabled, and at the age of 50, he wouldn't recommend it. I almost dropped to my knees because this is not something that I wanted to do. I started receiving spine injections and had good relief from there. As my pain started coming back and my narcotic prescription drugs were not working, again, my mental health was terrible. I knew I couldn't go on with life this way. I remember the day that I phoned my mom, who has now passed away and was one of my greatest supporters, crying in so much pain, asking her for her advice. I came across another good thing, and that was a health and wellness program. It teaches you all about nutrition, the foods that cause inflammations, and inflammation causes pain. My mom said that my health is number one, and you need to try this if you heard good things about it. I followed the plan for a year, and I only got one spine injection. The second year, I got 2 spine injections. The last injection I received was last July, and sadly, I had no relief. I felt it was due to waiting too long, and then the services were shut down due to the pandemic, which no one had control over. As time went on, I realized that I needed to accept my condition. I started to research and do more research, and found many things that I needed to be responsible for. I held and hold myself accountable in order to manage my pain. In my life, the best way I can for myself, my family, my friends, and my full-time job. Some of the things that I need that helps me a lot is keeping a positive mindset, focusing on good nutrition, watching my sugar intake, and being aware of the foods that causes my flare-ups. exercise, stretches, but making sure that when I'm doing them, it's not increasing my pain. Being aware that I have good days with manageable pain tolerance, accepting my bad days, and to focus on myself, ask my questions. What am I doing wrong? What have I increased in my diet that may have triggered my pain? For me, the food has been a huge impact on my chronic pain.
Thank you, Wanda. That, even just with Taylor mentioning that Eat Well Saskatchewan resource and the connection you made between diet and your pain. Yes, your story really resonated with me when you spoke. Tracy said something about there's not an easy button. You saying that you thought you had it easy, and boy, were you wrong.
Yeah.
To hear that coming from you folks, that's important. And then to hear your determination, your sheer determination in overcoming it. So thank you for sharing. I wanted to ask, you are such a strong person and so determined and motivated. And I'm wondering if you can speak a little bit to kind of your support system and what you've used to keep your own determination strong.
Well, I have a lot of support from my family. My co-workers, they've seen me in my terrible days, my bad days, and supported me, brought me wheelchairs if my knee gave out or something. But I would have to say I'm pretty I do my own self-research, and I use the internet, lots of YouTube videos just to give me strength, to make it through my bad days, and I've got this, and yeah, that's.
Yeah, sounds like a lot of perseverance.
Yeah.
Yeah. All right. Thank you, Wanda. That was really, like I said, important for us to hear and to share with other folks. So thanks for sharing your experience with us today.
You're welcome. Thank you.
All right. Take care. All right. And the next part of our program, we're going to move into our activities. So giving you folks another tool to help in your pain management. And I promise I haven't forgotten about the Zoom polls. We're going to do them all at the end. I don't know if anyone else has sticky notes attached to their computer screen, but I do. We're going to tuck them in right after we finish up with Wendy and her activity. So we're going to move on, like I said, with Wendy right now. So Wendy Nesseth is joining us today. She's going to walk us through an introduction to yoga. Wendy began her healing journey with a cancer diagnosis and a dismal survival rate from her oncologist over 20 years ago. Shortly after, she started researching what she could do to not only increase her survival rate, but also live a healthy and vibrant life. This is when she discovered yoga, meditation, supplements, and products that she has found have been key in building her vitality and her health. Her practice has helped her regain health and, more importantly, bring calm to a chaotic mind. She organizes and hosts virtual yoga and meditation retreats and has been teaching stress management and breathing techniques with the Art of Living for over 10 years. Her latest passion is helping women break out of the cycle of emotional eating and heal their relationship with their body and the food that they eat. Please join me in welcoming Wendy to walk us through an introduction to yoga.
Well, hello, everyone. Thank you for that fine introduction, and thank you, everyone, for your sharing. It's been my privilege being here and listening to all of you. So thank you so much for that. And my privilege to share with you all on yoga. Now, I'm not quite sure how to boil thousands of years of practice down to 10 minutes, but I will do my very best. So yoga has been around, like I said, for thousands of years. And, Patanjali, he's considered the father of yoga because he's the first person to codify the practice thousands of years ago, to write what yoga is. And he wrote it in this, it's called the Yoga Sutras. Each sutra is like a thread that ties us from the periphery of our life to our center. And what is so amazing to me is, even though it's been written thousands of years ago, it still is a roadmap for us today in the modern age, even through this global pandemic, or even maybe especially through it. And the first, not the first, but one of the sutras that speaks to me in what we need to share here today is Sthira Sukham Asanam. Sthira Sukham Asanam. And what this means when we translate it from Sanskrit to English is let my practice, let my seat, my asana be joyful and comfortable. And how is that possible if we're sitting here in a body that is already in so much pain? You know, how is that possible? And that is, you know, that's the question that we need to ask ourselves. Sometimes it's just a little tilt of our mind. So if we know, you know, if we're feeling pain in the body and we need to do something and we have all these things to do and we've got this pain going on now, how are we supposed to do that? That brings even more pain to us. So with what I'm going to share with you here with some moves, I just want you to always come back to that. Am I comfortable? Am I joyful? What can I do to bring more comfort in? If the answer is not do what I'm suggesting to do, then that's what you do. You don't do it. You modify, you listen to your body. So normally when I'm working with clients, especially with, you know, clients who are dealing with pain and to the severity that many of you are, I like to do a private, you know, consultation first so that I can make sure I'm tuning them into the right programs that they need to be in. Otherwise, you know, if we just put on a video and we're doing the practice, it's not the same communication. It's not the same back and forth where, because it's meant to, this whole practice is meant to be that communication with what's happening, you know, what's happening in your practice, what's happening in your mind as you're doing this. Is there some way that this could look differently to be more joyful and more comfortable? So with that thought, I'm going to invite you all just to, where you're sitting, sit up a little taller. I'm going to attempt some music here. And just sitting a little taller, let's just close our eyes and just bring yourself here to the space you're in. And just as you're sitting, just rock a little side to side, rocking side to side. Let your head and shoulders go with that rocking. Finding some ease, finding some joy. Maybe even smiling, even if you're not feeling the smile. And then just coming back through center, press your bottom down, lengthen the spine. And as you breathe out, just drop your chin forward to the chest. Let the back of the neck get long, looking down to the belly, down to the floor, even with the eyes closed. And then inhale, either chin level, or if it works for your neck, just lift your gaze up. If you have too much tension or pain in your neck, just keep it level. And then just let your head come to neutral again, dropping the chin forward on the out breath. And then roll your left ear to the left shoulder. And breathe out, chin forward to the chest. And then inhale to the other side. Exhale, let your chin fall forward to the chest. Inhale, coming to the left. And breathe out forward to the chest. Inhale, coming over to the right. And then just exhale, let your head come to neutral. And just inhale, this time bring your shoulders all the way up to your ears, like earrings, pressing them up. And then pressing them down. And again, bring your shoulders all the way up to your ears, pressing them up to the ceiling. Exhale, press them down. If you can move with the breath, so much better. Deep breath in. Deep breath out, pressing them down. And then just circle them once on your own, one way, circle them back the other way. And lift your hands up and give your hands a little shake. Just shaking out your hands. Shake, shake, shake. Keep shaking them. Keep shaking them. And then just reach your arms out to the side, palms looking up to the ceiling. Float your arms all the way up. And then just look up, lift your gaze up. Reach up through the baby finger side of your arm. Take a deep breath here. And then breathe out to reach your arms all the way out, pressing them out to the sides, pressing them down to the floor. And then bring them together in front of your heart. Press them together here in front of the heart. Breathe in, reaching them down again in front of you, taking them all the way out and up. Again, lift your gaze, maybe lean back a little, open the chest. Take another deep breath here, stretching into the sideways. This time as you breathe out, let your left hand land down on your right knee, your right thigh, somewhere. And your other hand just come alongside you to the chair you're sitting on. And then just look over your shoulder, like you're looking behind you. Take a deep breath in, see if you can get a little taller. And deep breath out, just looking further over your shoulder. One more breath here. Exhale, come back through center. And then just reach your arms all the way out and up, lengthening all the way up. Reach through your fingertips. Take a deep breath. Just see, can you get a little longer in your elbows, like you're lifting your hands away from the shoulders, which you are. You're lifting your shoulders away from your hips, just in a gentle way. Take a deep breath here, right to the bottom of the lungs. This time breathe out, bringing your right hand across. And your left hand just alongside you, maybe holding the chair. Pressing down to come into that twist, looking over your shoulders somewhat. Take a deep breath in. Breathe out, deepen the twist a little. Let's take one more breath here. And then breathe out, coming back through center. And then from center, just opening your eyes. Again, lifting your hands up, giving them a shake. And then closing your eyes again. And just taking just a few moments of stillness. Just see, are you here in your body? Where's your mind? Is your mind here in the space you're in? Are there lots of thoughts in your mind? How can you be a little more comfortable here? Is there something you need to do in the way you're sitting? Maybe pressing into the bottom with your sitting bones and lengthening the spine to create a little ease in between the joints. Just notice what you're noticing in this moment. Take another deep breath in. And breathe out. Coming fully here to the space you're in. Coming fully here to your body. If you notice any places of holding and tension, just even imagine you're breathing into those spaces. You're breathing some healing, some mobility, some freedom, some ease into those places. And just one more deep breath, nourishing yourself with that deep breath. And then breathe out. Gently letting your eyes open. I was told right before I started to keep it to 10 minutes, and then I forgot to start my timer right when we started. So I apologize if I went over there, Kelly. Thank you for joining in, everyone.
Thank you, Wendy. That was excellent. And I really appreciate those moments of stillness. I don't take a lot of time for that. And so I appreciate that reminder to take some stillness. Now let's just have a quick peek and see if there were any questions for Wendy in our chat. Taylor, I see you answered a question to Susan. I'll leave that in the chat for now. Wendy, I had a quick question for you, just kind of in relation to that last poll. What are some ways that folks can access yoga? And if they're interested in doing more yoga, where would you suggest they reach out to
I knew you were going to ask me that, and that's kind of a tough one because we are in a pivot right now. We used to have, of course, a brick and mortar studio where, you know, lots of the advertising was word of mouth. People would just come and find us that way. And like I said, many times it would be private sessions with clients. They'd book a series of appointments. All of that has changed now. So I'm offering all my services online. I do have a few in-person classes. In Yorkton here, we have a class, and I shouldn't even tell you about it because it's full with a wait list because we have restricted numbers who can attend, but just something to keep in mind. It's at the New Horizons Hall, Tuesdays and Fridays at 11 in the morning, 11 to 11:45, and it's a gentle practice geared for all levels. So it would be suitable, especially if there's any, you know, things going on for people with pain. I always, you know, connect with them, know what they're dealing with, and then give modifications. Same thing I do with our virtual classes, especially when it's clients that I'm working with. I do videos that I send out to people. Those aren't as effective because sometimes I don't know, like, how are they responding to this? I can't observe how they're working with it. So we have an active Facebook page, Body Poetry Fitness Studio. You can follow us there, message us through that. I have a new, like with the closing of my physical business, and this transition to virtual, we are in that pivot, developing the website and all that. So I can't even, give you links to that, but our Facebook is a good way. And my name is Wendy Nesseth. I'm on there as well. So you can, reach out to me that way. That's kind of if that's something you use, or just, calling or emailing.
Sounds good. Thanks, Wendy. And once again, we'll get that information for you so that we can share it with participants. You'll all be receiving an email after today's session with an opportunity for some more feedback, as well as links to our presentations and all of the services that we talked about today. Folks, it's 3 o'clock, and that brings our third and final, for now, let's hope there's more, session, Partners in Pain, the Yorkton and Area Community Engagement Events, to a close. Once again, thank you to Tracy and Taylor and to Wanda and to Wendy for presenting today. My biggest thanks goes out to each and every one of you for participating. Thank you so much for being here with us together, and looking forward to hopefully seeing everyone again in the future with more of these events. With that, I'm signing off. Take care. Have a great rest of your day.